Hello friends, welcome back. Today we're going to talk about the vaccines for the splenectomy patients. Well, patient who undergoes splenectomy should be given all three series of vaccines, that is Haemophilus influenza B plus pneumococcal vaccine plus two subtypes of the meningococcal vaccine. Usually either 2 weeks before the splenectomy or 4 weeks after the splenectomy. Some clinicians they give 2 weeks after the splenectomy, and in emergency situation, for example, gunshot wound patient or spleen lacerated and or patient seems to be non-compliant and the surgeon thinks they may not come back for the follow-up vaccination. In those scenarios, seen some surgeons give those all these three vaccine immediately after the spleen removal. Well, before you choose the vaccine, you have to be careful about the product you choose because the names can be a little confusing. For example, influenza B versus Haemophilus influenza B. Influenza B is a virus, whereas Haemophilus influenza B is a bacteria. Here we are interested in Haemophilus influenza B bacterial vaccine, which is the brand name is actiHiB actually. And the second set of vaccine we give is for the pneumococcal bacteria. These pneumococcal bacteria can cause pneumonia, meningitis, or septicemia. Basically, it's a streptococcus pneumonia. We call pneumococcal also. The vaccine we choose, you can choose is Pneumovax 23 or Prevnar 20. Some patient who already received Pneumovax 23 or Prevnar 20 before this splenectomy, in those patients you can give Prevnar 13 instead of repeating the same vaccine. Well, if you have to give both, let's say Pneumovax 23 or Prevnar 20 plus Prevnar 13, give a gap of 2 months in between. Don't give both together, And the third series of vaccine we give is for the two different subtypes of meningococcal vaccine, Menveo or Menectra or Menquadfi plus Bexsero or Menba. The brand names are a little tricky to pronounce, You need to give both subtype of meningococcal vaccine, that is meningococcal ACW135Y, and the short name is Menaqui plus meningococcal B for the protection against the Neisseria meningitidis. Because Menaqui does not provide protection against Neisseria meningitis or the serogroup B diseases. Similarly, meningococcal B serogroup vaccine, which is abbreviated as MEN-B, provide no protection against serogroup ACWY disease. Therefore, you need to give both the vaccine. The bottom line is you need to remember 4 vaccines, that is Prevnar 20, actiHiB plus Bexsero plus Menveo. All these are given intramuscularly. Sometime when we say asplenia, it doesn't mean the patient doesn't have spleen. Sometimes the spleen can become non-functional, especially in patient with the sickle cell disease, chronic sickle cell patient, the spleen can become like dysfunctional because of the clogging, So in those patients also, you can use these 3 different types of vaccine prophylactically. Thank you very much. Thank you.